Welcome to the Deep Dives, where we take a stack of information and really pull out the useful stuff for you.
That's the plan.
Today, we're turning our attention to something close to many of our hearts, the health and well-being of our pets.
Yeah, they really are family members, aren't they?
Totally.
Yeah.
And their health is, well, it's a top priority.
Absolutely. And that's why we're diving deep into this comprehensive guide on preventative pet care today.
Okay.
Our goal is really to equip you with actionable insights, things you can actually do to ensure a long, healthy life for your companion.
Right, without getting bogged down in, endless technical details.
Exactly. Keep it practical.
And we know you might have a brand new puppy, maybe a wise old senior cat, or even something a bit more exotic.
Yeah, this applies broadly.
So this is for you. We're focusing on those proactive steps, the things that really make a difference, no matter the age or type of pet.
Mm-hmm. At every life stage.
Okay, let's unpack this. Where should we start? Maybe the foundation. Routine vet visits.
Yes, definitely. That's really the cornerstone of, well, all proactive pet health, regular checkups.
Even if they seem totally fine.
Especially then, think of them like an early warning system.
Oh, yeah.
They let the vet detect potential issues early, monitor their weight, their growth, and of course keep vaccinations current.
Right, and I guess the schedule changes depending on how old they are.
That's exactly right. For puppies and kittens, those first few months are critical. Rapid development, building immunity.
So more frequent visits then.
Yeah, the guide recommends every 3 to 4 weeks, usually until they hit about 16 weeks old.
Wow, okay.
It ensures they get that initial series of shots and just builds a solid health foundation.
Makes total sense.
Yeah.
So much happening early on. What about adult pets? Once they're past that kitten or puppy stage,
For most adult pets, generally an annual checkup is the standard recommendation.
once a year.
Yep. Lets the vet do a thorough physical, talk about any changes you've noticed, any concerns.
Okay.
Now, where it gets interesting is with senior pets.
Ah, the golden years. Typically, what age is that?
Usually around age 7 or so for most dogs and cats, though it can vary a bit.
And they need more visits.
Often, yes.
Yeah.
They can really benefit from more frequent checkups, maybe biannually.
Biannually. So twice a year. Why the increase for seniors?
Well, just like people, as pets age, they're more prone to certain conditions.
Makes sense.
So seeing them twice a year significantly boosts the chances of catching things early. We're talking diabetes, kidney disease, even subtle signs of arthritis.
And what happens during these checkups? Is it just a physical exam?
It's often more comprehensive, especially for seniors or if there are concerns. Might include blood work, urinalysis, definitely dental exams,
Okay.
and something called body condition scoring.
What's that?
It's basically a hands-on way for the vet to assess their weight and muscle mass, make sure they're not too thin or too heavy.
Gotcha. So these regular visits, they're really about early detection, catching things before they become big problems.
Precisely. Like you said earlier, catching that flicker before it becomes a flame.
Okay, moving on. The guide also really hammers home vaccinations and parasite prevention. Feels pretty non-negotiable.
Absolutely crucial. Vaccines are, they're lifesavers. They protect against serious, sometimes fatal diseases.
Right.
The guide mentions core vaccines, think rabies and distemper for dogs, and things like feline herpes virus and calicivirus for cats. These are generally recommended for pretty much all pets.
They're the foundational ones.
Exactly. Basic protection against really nasty, contagious stuff.
But then there are also non-core vaccines. What's the deal with those?
Yeah, non-core vaccines are more tailored. They depend on the pet's individual lifestyle, where they live, what risks they're exposed to.
So, give me an example.
Okay, so a dog that goes to dog parks or boarding kennels a lot.
Yeah.
Your vet might recommend the Bordetella vaccine, that's for kennel cough.
Ah.
Or a cat that goes outdoors might need the feline leukemia virus vaccine. It really depends on their specific situation.
So it's a conversation to have with your vet.
Definitely. They'll help you figure out what makes sense for your pet. It's not one size fits all.
Right. Okay. And then parasites.
Yep. Not most fun topic,
Right.
but so important. The guide flags the big ones.
Fleas and ticks?
Fleas and ticks, yeah, they cause irritation, obviously, but also transmit diseases like Lyme disease.
And heartworms. I hear those are really bad.
Very serious. Spread by mosquitoes, often fatal if not treated, and treatment is tough.
Yikes.
And then you've got intestinal worms, roundworms, hookworms.
Oh, yeah.
Not only bad for the pet, but some can actually be transmitted to people.
Double yikes. Okay, so what do we do? How do we defend against these tiny terrors?
Prevention, prevention, prevention.
Yeah.
The guide strongly pushes for year-round prevention.
Year-round, even in winter.
Yep. Parasite seasons are getting less predictable, and indoor pets aren't totally immune either. Mosquitoes get inside.
Good point. What kind of prevention are we talking
Yeah.
about?
There are lots of great options now. Topical treatments you put on their skin, oral medications, often flavored like treats, and even some longer-lasting injectable options. Again, your vet is the best resource to choose the right one for your pet and your area.
Okay, vet consultation is key there too. Let's shift gears to something we control every single day. Nutrition and weight.
Ah, yes. This is a huge one. Such a controllable factor.
It seems like it impacts almost everything, right?
It absolutely does. A good diet fuels them, obviously, but it also supports their immune system, keeps their coat healthy, and really importantly, it dramatically reduces the risk of chronic diseases down the road, things like obesity, diabetes.
So what should we be feeding them? The options are overwhelming.
Tell me about it. The guide basically recommends either a high-quality commercial pet food, one that meets established nutritional standards like AAFCO,
Right.
or if you're inclined, working very closely with your vet or a veterinary nutritionist to create a balanced homemade diet.
Homemade needs expert guidance, though.
Oh, absolutely. You can easily miss essential nutrients otherwise, but whichever route you go, quality and balance are key.
And what about treats? We all love giving treats.
We do, but the guide gives a good rule of thumb. Treats shouldn't make up more than, say, 10% of their total daily calories.
10%. Okay, mental note made. I might need to cut back.
Many of us do. It's easy to overdo it.
So how do we actually know if our pet is a healthy weight? Sometimes it's hard to tell, especially with fluffy ones.
That's a great question. That body condition score chart we mentioned earlier, that's super helpful.
Right.
It's a visual and hands-on guide. You learn to feel their ribs, look at their waistline from above and the side. Your vet can show you how to do it easily.
Okay, I should ask about that next time. Why is keeping them trim so important?
Well, the guide is pretty clear on the risks of obesity. It puts extra strain on their joints, leading to pain and arthritis.
Yeah.
It increases their risk of heart disease, diabetes, even some types of cancer. Yeah. And sadly, it can shorten their lifespan.
Wow. That's sobering. Yeah. So it really just boils down to portion control and making sure they get enough exercise, right?
Exactly. Calories in, calories out. It's that balance.
Okay. Now, something maybe less obvious, but the guide flags it. Dental health.
Yes. Often overlooked, but so vital for their overall well-being.
Really? I mean, beyond bad breath.
Oh, way beyond bad breath. Dental disease involves pain, inflammation, possible tooth loss. It can make eating difficult.
Okay, that makes sense.
But here's the kicker. The bacteria and inflammation from the mouth can actually get into the bloodstream.
No way.
Yeah, and it can affect major organs, the heart, the liver, the kidneys. It's a systemic issue.
Wow. Okay, that connection is powerful. I hadn't fully grasped that. So what can we do about it at home?
The guy has some really practical tips. Number one is regular teeth brushing.
With pet toothpaste, right, not human toothpaste.
Absolutely. Human toothpaste can be harmful. Pet-specific toothpaste is key. It takes patience, positive reinforcement, but it's the gold standard. You can also offer dental chews or toys designed to help scrape off plaque.
Okay, those seem easier.
They can help, yes, but brushing is best. And then, critically, professional dental cleanings.
At the vet's office?
Exactly, under anesthesia so they can clean thoroughly, especially under the gum line. That's where the real problems often hide. Your vet will recommend how often.
So even if they seem fine, there could be issues lurking.
Precisely. Preventative dental care really impacts their quality of life long term.
Got it. Okay, next topic. Spaying and neutering. Most people know this stops unwanted litters, but are there other benefits?
Yes, definitely. Preventing litters is huge, of course. Helps with pet overpopulation, reduces shelter numbers.
Right, the community aspect.
But there are significant health and even behavioral benefits for the individual pet, too.
Like what?
Okay, for females, spaying, removing the ovaries and uterus virtually eliminates the risk of uterine infections, which can be life-threatening.
Wow, eliminates.
Pretty much.
Yeah.
And it drastically reduces the risk of mammary tumors or breast cancer, especially if done before their first heat cycle.
That's significant. And for males, neutering.
For males, neutering removes the testicles. This eliminates the risk of testicular cancer and greatly reduces problems with the prostate gland later in life.
Okay.
And it can also decrease certain hormone-driven behaviors like roaming to find a mate, or some types of aggression.
So it's good for them, good for the community, kind of a win-win.
Absolutely, a responsible choice all around.
Now, the guy also talks about something maybe not strictly medical, but essential: mental and physical stimulation.
Yes, this is so important. Wellness isn't just physical health. It's mental well-being, too.
How does that connect to health?
Well, a bored, understimulated pet is more likely to develop behavioral issues, anxiety, destructiveness, compulsive behaviors.
Ah, I see.
And chronic stress from boredom or anxiety can actually impact their physical health, weakening the immune system.
Right. So keep them busy, keep them happy. What kind of things should we be doing?
It's about finding outlets for their natural instincts and energy levels. Daily exercise is key walks, fetch, playtime, whatever fits their breed and age.
Tailored to the pet.
Exactly. A border collie needs more than a basset hound. And then there's mental enrichment.
Like puzzle toys.
Puzzle toys are great. They make them think to get a reward. Short, fun training sessions work well too. Set games hiding treats for them to find.
Using their noses.
Yep. And socialization, especially when they're young, is vital. Getting them used to different sights, sounds, people, other animals.
Helps prevent fear and aggression later.
Exactly. Builds confidence.
The guide mentioned specific things for cats, too, didn't it? They're not always keen on walks.
No, not usually.
Ugh.
For cats, think vertical space climbing trees, shelves. They love being up high.
Okay.
Interactive toys that mimic prey, wand toys with feathers, laser pointers used responsibly, and maybe even safe outdoor access like a catio, a protected patio, or supervised time on a harness and leash if they tolerate it.
Lots of ways to keep their minds and bodies active. A busy pet is a happy pet.
And usually a healthier pet, too.
Okay, then we have grooming and skincare. Is this just about looking good?
Not at all, though that's a nice bonus. Regular grooming is actually important preventative care.
How so?
Well, brushing prevents mats in longer-haired pets, which can be really painful and pull on the skin.
Oh, shit.
It also lets you check regularly for fleas, ticks, lumps, bumps, skin irritation. You catch things early. Plus, it stimulates circulation and distributes natural oils.
Okay, so what's a good routine? Does it vary a lot?
It really does. Depends heavily on the breed, coat type, lifestyle. A long-haired Persian needs daily brushing, a short-haired cat much less.
Right.
Same with bathing. Some dogs need it frequently, others rarely. Nail trimming is important for posture and comfort for most pets.
And we should be looking out for problems.
Definitely. Watch for excessive scratching, redness, flaky skin, hot spots, any weird odors. These could signal allergies, infections, something needing a vet check.
What about ears and eyes?
Good point. Gentle cleaning as needed helps prevent wax buildup or irritation. Some breeds are prone to ear infections.
Right.
And the guide mentions for pets with known skin issues or allergies, the vet might recommend special diets, supplements, maybe medicated shampoos.
So grooming is another chance to monitor their health closely.
Exactly. It's hands-on time with your pet.
Okay, nearly there.
Okay.
The last major section in the guide is about safety pet-proofing the home.
Yes, so critical. Accidents happen, but we can prevent a lot of them. Our homes have hidden dangers.
Like toxic foods.
Absolutely. The guide lists common ones. Chocolate, grapes and raisins, onions, garlic, anything with the sweetener xylitol.
Xylitol is in sugar-free gum, right?
Yeah.
And peanut butter sometimes.
Yes, exactly. Always check labels. Also, some houseplants are surprisingly toxic.
Oh yeah? Which ones?
Lilies are extremely dangerous for cats, even the pollen. Aloe, pothos, Dieffenbachia. Many common ones can cause problems if ingested. Best to check before bringing a plant home.
Good tip. What else should be secured?
Human medications are a big one. Cleaning supplies, antifreeze, sharp objects. Basically, anything you wouldn't want a toddler getting into.
Treat them like curious toddlers, essentially.
Pretty much. And the guide also stresses microchipping and ID tags.
Absolutely essential.
If they ever get lost, it's often the only way to guarantee they get back home safely. A quick, simple procedure that can make all the difference.
Can't argue with that.
Yeah.
Okay, so wrapping this all up, the main message seems to be that prevention is way better than cure.
That's the core of it. Investing a little time and effort in this general wellness, this preventative care, It's truly an investment in your pet's future health and happiness.
And it reduces the risk of illness, improves their quality of life.
And honestly, it can save you a lot of money and heartache from expensive emergency treatments down the line.
And it doesn't need to be overwhelming, right?
Yeah.
It's about building habits.
Not at all. As the guide shows, it's often about simple, consistent things. Those regular vet visits we talked about.
Right.
Feeding a good diet, keeping up with parasite control, brushing their teeth sometimes, making sure they get daily enrichment.
It all adds up.
It really does. These small habits make a huge collective difference.
So if we had to boil it down, key takeaways are regular vet checks, good nutrition and weight management, parasite control, dental care, and daily mental and physical activity.
That's a perfect summary. It's about that holistic approach. By committing to their well-being through prevention, we're giving them the best shot at a long, joyful, healthy life with us.
Well said. So a final thought for you listening. Think about just one small change, one thing you can implement starting today based on what we've discussed. What's one step you can take for your pet's long-term health and happiness? What will it be? That's our deep dive for today. Thanks for tuning in.